Thank you very much for the opportunity to speak today. So I'm going to be covering some work that...
sorry, you can use a microphone. You can use, yeah.
Is that any better? Yeah. So I'll be covering some work that I've been participating in as part of the Quads team. This is mainly a simulation modelling study, but I'll go through that during the talk. Oops. So I'll just cover a little bit about the group itself, why we're doing what we're doing, how we're doing it, and then some preliminary results and how they're going to be used. So the Quads EPI team, which has been covered quite a lot by Tom, is Canada, USA, Australia and New Zealand, and the UK and Sweden are currently guests. We've all got independently developed models that can carry out simulations for foot and mouth outbreaks. So some of them are usual suspects that you'll know of, but the Australian model is fairly new. And DTU have only just, Sweden's just joined with the DTU DADS model. And basically the motivation for the Quads EPI team is to bring together some very unusual skill sets, modelling and epidemiology, and FMD provides a focus for us to practice those skills, to keep our hands involved, and we're all starting from the same point in that we're disease-free without vaccination. So the motivation for this particular piece of work was that could we look at, following on from doing some previous work that highlighted the benefit of early vaccination campaigns, we wanted to know if we could find any features at the beginning of an outbreak which could indicate the overall size and shape of an outbreak at the end, which we're calling severity, which is different for each different country, but generally we're looking for indicators that an outbreak is going to be particularly large in terms of numbers of IPs or the area that's under disease control restrictions or the duration of the outbreak. And knowing early on in an outbreak can give us the time needed to mount an efficient vaccination campaign, because we all know you can't just say, let's vaccinate and go for it. There's logistics involved, vaccine matching operations, standing up vaccination resourcing contracts, and literally getting needles in hands that are trained to use them. And we've used a modelling approach sorry, this is probably stating the obvious, we don't have a huge amount of data on the ground, but it does mean we can produce an exceptionally large bank of data that we can then use for the investigations, covering lots of different starting conditions. So each individual country had a different study area, which they determined themselves, but we have harmonised the virus spread characteristics of each of the models. We tried to include a range of different farm types and species, and the first detection was based on the country that was doing the modelling. So the first detection in the UK is slightly different to the first detection probability in, say, Australia. And the control measures we used, although we got vaccination in mind, we didn't actually use that in this case. We're starting from just the simplest control measures, which is a stamping out policy for IPs. And we ran iterations for 365 days or until disease was eradicated, whichever came first. Each iteration of the 10,000 was seeded randomly over the study area. And there were some restrictions applied just to limit the number of outbreaks that didn't go anywhere. So if you seeded into a hobby farm, it might not spread anywhere. And again, 10,000 for each country. If one of the 10,000 runs ended up with no detection, it was just excluded. So this is just a pictorial representation of the different study areas. Canada and the USA, obviously they're huge countries, so they restricted their study areas to some particularly interesting regions. Australia and New Zealand used the whole of the country as the study area, but just restricted seeding to certain regions. And the UK and Sweden used the whole country. I apologise to Sweden for missing them off that slide. So some of the early decision indicators we're looking at are IPs, herd density, cattle density, pig density, and human population density around the initial seeded farm. So these are measures that we think we can get to easily in an outbreak and can be possibly indicative of how severe the outbreak would be. And our measurement of severity, as in the outbreak metrics, is in the total number of IPs for the entire simulation, the new IPs from a given time point, which in this case we've used 7 days, 14 days, and 21 days, and then the epidemic duration from beginning to end, and the area under control, which is a 10-kilometre buffer zone around each individual IP. So, having done our 10,000 runs, this is a little bit of an indication of what they actually look like. We had some fantastic variation over sizes of different outbreaks, which is good from our point of view, so we get some big ones to try and predict. Sweden was generally the smallest outbreaks, and the USA was generally the biggest ones, although New Zealand had some pretty big ones as well. So I won't linger on this slide. So then the outbreak, the outcome variables that we were looking at, so this is what we're trying to predict, the severity of the outbreak. Again, this is just a descriptive to look at the different variation. Again, Sweden had some pretty low numbers. The USA had the highest area under control restrictions. And again, it's just demonstrating we had some great variation over the 10,000 runs. So having got our data on our explanatory variables and our outcome variables, we then use linear regression to build some models for each individual country at each of the individual time points that we're looking at, then simplified them. And each of the countries retained different explanatory variables within the linear regression models that we ended up with for each of the different time points. And this is just a descriptive of the model fit, which is, perhaps unsurprisingly, the fit improved from the 7-day data to the 21-day data. And there's some good, some pretty poor, but sort of as expected. And then we went on to use these linear regression models, the final simplified one, to attempt to predict the outcome variables from the early indicators. Now, unfortunately, the cut points are pretty arbitrary because there's some quite differences between countries, as in a small outbreak in the USA, in the UK, would be enormous. So it was quite hard to harmonise between the two, but we've tried our best. So most of the individual countries involved concentrating on the time point that was most relevant to them, usually with respect to when they're likely to have vaccination ready to go, which is not the same across all the different countries. And the outcome was that the area under control and the total IPs tended to be the severity indicator, the severity scores that we could predict most often correctly. And the number of IPs up to a given time point had the most predictive power to make those predictions. So I should have mentioned this earlier, but this was based on 2 previous studies where we've taken the results from their first fortnight spatial spread and first fortnight incidence, and we've added on some extra time points, other explanatory variables. I'm not sure if they're here this week. If they are, thank you very much. And we've attempted to investigate some other time points because of this potential benefit of starting vaccination early. So the upshot of the work here is some of our explanatory variables were very explanatory and some were less so, but the idea is not totally out of the question. We did get more than a random number of correctly classified severity outbreaks. And just to quickly mention, the reason, again, that we're doing this is because incorrect deployment of vaccine has cost implications, as well as not using it when it would be beneficial. So having some indication of whether or not an outbreak might reach the scale where vaccination is beneficial could be very useful, not just in welfare issues, but in terms of managing an outbreak effectively. And then going forward from this step, we have some plans to potentially investigate other EDIs. Again, because we've built up this data bank of 10,000 runs, we can actually use the same ones just to investigate other factors. So delays in culling, farm types, dissemination rates, etc. And we can even add to this data library with other additional control strategies or other additional models even. So just to say thank you to all the governments and agencies involved. This was a truly international study, and it's incredibly hard to get international funding. So we really do appreciate that these countries have all supported us and the work we're doing, and also the other Quad Zepi team members. And that's it.
Thank you very much. Are there some questions?
Everyone's stunned.
I've got one. You have taken into account the density of animals, of human population, and so on. Have you taken into account the interactions, I don't know how to say that with my broken English, but the trade and the movement and the high-risk areas, for example, markets or things like that?
Yes, so within each of the individual models, they will have movements that are parameterized to their own countries. So all of those, sorry, was that what you were asking? I got that right, yeah. Everyone does it slightly differently. Because all the models were independently developed, they all concentrate on slightly different things. But in the UK, we go back through our movement records and use them to produce a movement generator, which can then generate that silent spread period.
Thank you. Question? No, it's clear for everybody? 1, 2, 3. Okay, so thank you very much again. Thank you.